kids are the most important part of my life. I want to do all I can to help them succeed. One of the best ways I can help them is by helping myself. If I'm healthy, I can be there for my children when they need me. Let me share some things with you that I've recently learned about my health as an African American.
Did you know that African Americans are at greater risk for certain health problems? We also often have a more difficult time finding health care. There are 3 areas that we need to learn more about to improve the health of our families and neighbors. First, we can learn how to eat healthy and stay active. Second, we need to understand the importance of visiting a doctor even when feeling healthy. And last, we can learn what we need to do to have healthy newborn babies.
While more than half of Utahns are overweight or obese, it is an even bigger health concern for African Americans.
Nearly 7 out of 10 of Utah African Americans are overweight or obese. Being overweight or obese makes it more likely that you will have diabetes, heart disease, or a stroke. All of these serious problems impact your ability to do the things you want to with family and friends. The good news is you can take action by making simple changes in your life. You can enjoy food, but eat less by avoiding oversized portions. Half of your plate should be fruits and vegetables. Another good way to maintain a healthy weight is to make at least half of your grains whole grains. Switching to fat-free or 1% milk is also an easy way to keep your weight in a healthy range.
We try to eat more vegetables, 2 vegetables per meal. We try to get a lot of water. We try not to bring too much soda, too much other stuff into the house. But really it's just the vegetables and making sure that we're eating as a family at dinner time, and everybody kind of enjoying that experience.
By using the information found in the nutritional label, you can learn which foods are better for you. Compare calories, saturated fat, and sodium or salt in foods like soup, bread, frozen meals, and then choose the foods with lower numbers. Pay attention to how many people a package feeds by looking at the serving size. Drinking water instead of sugary drinks is healthier. A large soda contains 3/4 cups of sugar. Never go shopping in the supermarket when you are hungry. The healthiest foods are often found on the outer edge of a grocery store. Frozen vegetables and fruits are a great lower-cost way to eat healthier.
I would tell other kids my age that they need to eat right, not eat junk food, McDonald's and stuff like that. Get involved in a sport you like to do, like running. Do stuff with your friends instead of just sitting in the house all the time.
Physical activity is an important part of maintaining a healthy weight. Get at least 2.5 hours of exercise each week. Children need even more time being active. Limit time spent in front of television and video game screens to less than 2 hours per day. I never truly understood the importance of exercising until I had my 2 kids. I was a full-time mom, a full-time student, and I worked part-time. There weren't enough hours in the day for me to exercise on a regular basis until I saw my doctor. He informed me that I had high blood pressure and I was overweight, so I knew I had to make a change. I started working out with my friends, my family, and coworkers, and I started eating healthier. I exchanged fatty foods for fruits and vegetables, and I immediately saw a difference. As a result, I have more energy, I feel healthier, I feel so much better.
Another important area where we need to educate ourselves is about the importance of regular visits to your doctor. Everyone should have a family doctor for regular checkups, even when you're feeling healthy.
Visiting your doctor regularly can prevent illness or early death. Many forms of cancer are curable if found early through screening. High blood pressure, high blood sugar, and high cholesterol levels do not usually show symptoms and can only be found through screening. If caught early, these levels may be lowered with simple lifestyle changes and medication. If not found, they can lead to diabetes, heart disease, and stroke.
My kids have been going to their family doctor since they were born, and that doctor knows them by name. He knows their history. He knows pretty much everything about them, and I think that's really important for them to have that connection. So when they go into the doctor, they know that face, they know that voice, they're comfortable, and it's a less threatening environment and situation for them.
Visiting a family doctor is less expensive than visiting the emergency room. Emergency rooms don't know your medical history, and this can lead to very expensive and unnecessary tests and procedures. If you don't have health insurance, there are many state programs to help you get health insurance. There are also many Utah clinics that accept patients at discounted rates. Call 211 or visit www.211ut.org for referrals to health, food, and other services. You can also ask family and friends for a referral. Call 911 only for help during life-threatening emergencies, crimes, and fires.
My brother called me one day on the phone, and he was just telling me about a friend of his that had some medical problems, and he was just really stressed and overwhelmed because he had just recently lost his job and he didn't have any medical insurance. And so he was just asking me what he could do in that situation. And so one of the things I let him know is that there is just a wealth of resources in the community. One of the main ones I suggested that he contact was the state of Utah. And what I suggested you do is just go online to jobs.utah.gov and apply for medical assistance. They've got medical assistance for everyone, you know, women, children, men, families, couples. And so that's what he did. There's also other community resources that I suggested, like 211, or even just the medical health clinics in the community.
Getting health care is important to everyone. It is especially important for pregnant mothers. As African Americans, we need to make sure our babies have the best chance at success.
As a mother, it is important to think about your needs and your baby's needs. All women of childbearing age should take a multivitamin, not just those planning to have children. About 1 in 3 births are unplanned. You may not know you are pregnant. You should take a vitamin with 400 micrograms of folic acid every day. Folic acid is a natural vitamin that comes from foods like oranges, cereal, and leafy green vegetables. Folic acid prevents birth defects such as spina bifida. Waiting to take folic acid after becoming pregnant is too late to prevent birth defects. Visit a doctor for a checkup before becoming pregnant. Women who are not at a healthy weight before getting pregnant have a higher risk of delivering too early and having other complications such as diabetes during pregnancy. It is very important to visit a doctor during the first 3 months of pregnancy. Make sure to attend all of the prenatal visits. It is important to involve your baby's father. Do not smoke or drink alcohol during pregnancy. If you smoke while you're pregnant, it can cause many health problems for your baby, like being born too early or with low weight.
It's very important for pregnant mothers to not smoke or quit smoking, so that the baby can, come full term and not have a low birth weight or not be stillborn. Also, developing respiratory issues like asthma. Those are some of the important things that they need to think about while pregnant.
For the first 6 months, the baby should only drink mother's milk. Continue to breastfeed the baby along with introducing new foods until the baby is at least 1 year old. Breast milk is more nutritious for babies than formula. Breastfeeding helps protect babies from illness and sudden infant death syndrome. Breastfeeding also helps mothers return naturally to pre-pregnancy weight.
Research done in 2006 did illustrate that the mother's body needs to regenerate itself to allow for a good birth of a child. So it's very important that after a pregnancy or after a childbirth to wait at least 18 months before getting pregnant again to reduce the risk of lower birth weight and allow the mother to build enough calcium, iron, and other nutrients necessary to be able to have another child.
Take your child to all of the well child visits like your doctor recommends. There are programs like WIC that offer assistance paying for healthy foods for pregnant and nursing women and for infants and children. WIC also provides information and support with breastfeeding. Mothers expecting a baby can find help at babyyourbaby.org or call 1-800-826-9662 or your local health department. If you need help to quit smoking, call the Utah Tobacco Quit Line at 1-800-QUIT-NOW.
By learning about these health issues that affect all of us, we can make life better for our families. Simple changes can result in a healthier and happier community for me and for us.